of Western medicine are names of symptom groups, and they are not illnesses that we are programmed to have. So we see hypertension, that's just a stress response. We see obesity, that's a combination of hormonal imbalances and nutritional deficiencies and toxicities. We see high cholesterol is just a liver antioxidant stress marker. So we don't, when someone's given a diagnosis by a traditional doctor, you're not destined to have that illness. It's your body. These are symptoms, and your body is displaying that it's not happy. What's really going on is the key three things that new medicine is based on. It's a combination of increasing toxicity and the secondary effects of hormonal imbalances, both excesses and deficiencies, and of course nutritional problems that result in all of these different things. Of course, our genetics decide what we're going to get, how our body's going to respond, and families are going to respond similarly. But our genetics are all responding in a way to tell us that we are killing ourselves and we need to wake up. And that's what new medicine is all about. So getting into a few brief slides, this is all about chronic illness. That's really the epidemic of everything. We're not talking so much about acute illness here. Infection, trauma, those things happen. That's where traditional medicine works. But chronic illness can be described as anything that's affecting the elderly and dementia, Alzheimer's, to our youth, with the increasing amount of juvenile illnesses like asthma and autoimmune conditions, diabetes. It's all chronic illness. It's all a progression of these three key underlying principles. The bad news is that we're all getting this stuff. It's almost inevitable. 98% of us will get something unnatural and die of something unnatural, and that's not how we were designed. It makes no sense. We are incredibly complex living things that have evolved over, we've really been in this form for around 50,000 years, or perhaps we are of the mind that we were created in this way. Whatever you believe, we weren't created to become so unhealthy at younger and younger ages. So we know this. The world knows that the diagnostic modern medical model really isn't working. The treatments aren't working. They're incredibly toxic. They're incredibly expensive. They're the number one reason that we're not only getting sick at earlier and earlier ages, but why our economy is failing and this country is bankrupt. It's completely unsustainable. Few people are really healthy, regardless of whether you're going to your doctor, whether you're taking your medications, even those trying to be healthy, even all of the alternative medicine out there. Unfortunately, there's not enough science to really document that we're truly healthy. The good news is we really feel new medicine has the answers. We can see these illnesses developing from miles away biochemically. We can see them very obviously in our patients at a glance. We can see our bodies screaming out for help. We can understand that the symptoms being described are not symptoms of an illness that is genetically programmed. They are symptoms of these imbalances that need to be corrected, both physically and mentally. And when we apply the new medicine protocols, it's incredible how every illness out there will start to correct. The body wants to heal. Provide the biochemical balance to the body and it will begin to heal, and it heals quickly with the programs, the knowledge and the science we've put together. Within days, people are feeling better. Within weeks, they are changed. And within months, the illnesses can be completely resolving. We often say that it may take a year for someone who's seriously ill after a heart attack or a stroke, is on 6 or 12 medications, 60 to 100 pounds or more overweight. It may take a year, but to undo that much illness in 1 year that's been evolving for 40, 60, 80 years is fairly incredible. The principles, the techniques in new medicine happen more quickly and are almost more powerful than drugs that are used today because the body is so powerful in its healing. So chronic illness, that's what we're talking about. We're going to talk about a lot of different ones. It's the number one cause of disease, death, and the deficit. But in the modern world, we're not talking about third world countries here. Of course, there we do still have just caloric intake problems and infection problems that used to rule the world. But in modern countries now, with improved sanitation and food supply, we don't have a problem with infection and calories anymore. We have a problem with toxicity that results in hormonal imbalances. We have toxic food supply. We have toxic lifestyles and reliance on toxic medications. So that's the number one problem. Cancer is now number one. And I'm going to gloss over some cancer slides tonight, but we did a really fun an in-depth cancer discussion, focusing on breast cancer towards the end, but about cancer in general about a month ago at the end of Breast Cancer Month. That's on our website. So I'm going to gloss over cancer tonight, but it is the #1 killer. It is the #1 thing to be scared of. If we're going to be scared of something, we have no control over the epidemic rate of cancer. It is really the ultimate sign of body disease. Our bodies begin to grow uncontrollably, forming tumors. Our immune systems are unable to control these cell divisions, and we kill ourselves. That's what cancer is. And it's increasing epidemically, and we're doing nothing to beat it. And we're focusing on slash and burn, chemotherapy, radiation. We're focusing on early detection and treatment, which is incredibly profitable, but not the true causes. And in doing so, it's getting worse. So cancer is #1. Heart disease not far behind. 85% of everybody alive in modern worlds has it developing. That's fairly incredible. Despite all of the traditional medicine, doctor's visits, medications, statins, blood pressure, still 1 in 2 heart attacks will be the first sign of heart disease. So we're horrible at finding this beforehand, traditionally. We, of course, with new medicine comprehensive labs, find the signs of it, the multifactorial causes of it very quickly. But people are going to their doctors, walking out with either a clean bill of health or walking out with their statins and platelet blockers and what have you, beta blockers, and having a heart attack the next week because it doesn't allow the body to heal from the illness. It simply can, these medications can simply delay the end event for a while. Diabetes, completely rampant. 1/3 of the American population has it. 1/3 is getting it and has no idea. And it's the easiest. These are all actually easy to prevent and reverse, but diabetes is really extremely easy because it's mainly a problem of caloric and glycemic overload and insulin resistance. Along with this, obesity. Unbelievable what we're seeing in our society. The morbid obesity, the obesity in children. You know, we talk about America leading the way. Well, India, China, the developing countries are following our lead with their increasing toxicity, worsening food supply, reliance on medications, you name it. Autoimmune diseases. These things are becoming more epidemic as well. Multiple sclerosis, lupus, scleroderma, psoriasis, Crohn's, ulcerative colitis. These things are all chronic illnesses that did not used to affect us, and they are all epidemic, and we are using horrible drugs to control the symptoms. Osteoarthritis and porosis in 25% of men and 50% of women over 50 years old. Unbelievable. Our bones are not meant to do this. We're taking more osteoporosis drugs and calcium than any other country in the world. It's obviously not working. There's other causes to these problems. Also, these things affect kids. The most concerning thing why we are at the tipping point, we're at the edge of the cliff, because we are allowing our children to get sick and saying they simply need more medication. Obviously not working, and this is embarrassing. We have to step up to the plate and say we are not going to allow this to happen. We are not going to allow our children to not only be in a poorer place financially, but a poorer place physically and mentally. We don't feel good. So we talk about all of the diagnoses that we're going to tie in the traditional diagnoses tonight and possibly next week. See how much we can get through tonight. But it's not that this group of people over here has high blood pressure, and this group of people over here is going to get Alzheimer's, and this group is going to have bone problems. All of these problems are a combination and a presentation of inflammatory problems from toxins and hormonal imbalances and nutritional deficiencies. These toxins come from the environment, our foods, our increasing medications, our toxic lifestyle. We know this. The world is toxic, we are toxic. That's the #1 problem and why we have to detoxify. And these imbalances in hormones, deficiencies, nutritional deficiencies cause a weak immune system. So we become more inflamed. That's the common denominator of most illnesses is inflammation. And our immune systems are overwhelmed. Our immune systems should be able to control this inflammation, but they can't. They're weak, they're confused, they're deficient as well. We can talk about D3, hormonal deficiencies like cortisol, androgens. They all tie together to have this inflammatory common denominator. Inflammation is the fire inside of us burning our organs. Inflammation in the arteries is heart disease, in the brain is Alzheimer's, in the bones is osteoporosis. There's an inflammatory component to cancer. And we'll talk, a lot of people talk about antioxidants. That can be a hot wonder cure. Oxidation is the end result. It's the smoke off the fire. And antioxidants can help blow the smoke away, but we need to get to the root of the problem, the inflammatory problem. This is how inflammation is probably one of the big things we look at when we look at our labs. And we look at a couple of different markers. We look at how much chronic inflammation there is. Inflammation can be acute as well. We look at C-reactive protein, which is a whole body marker for inflammation, not just a heart marker as the labs show or as the only way traditional medicine really recognizes it. Homocysteine is a very important inflammatory marker, more specific for the cardiovascular system, relates to B vitamins, thyroid function. There's no drugs for these yet, and so they're not of importance in the traditional world, but they're great markers to show how much inflammation we have anywhere in the body, or more specific to the cardiovascular system. These should be checked on a regular basis and checked in everybody yearly. Very important. The inflammation can be acute. We can see whether it's acute. Iron markers called ferritin can be inflammatory markers. When we see inflammatory markers very, very high, sometimes that's not as concerning to us because we know it's acute. We know someone might have a little infection or something very new. So new medicine physicians know how to determine whether it's chronic, whether it's acute, how important these markers are. And they typically always reverse very quickly with our treatment. With detoxification, restoring the balance, restoring the hormones and nutrients that help the body control this inflammation. We're removing the toxic causes. We're restoring the balance biochemically to control the inflammation. So when people talk about, is my pain going to get better? Is my bad disc in my neck or my back going to get better? My achiness, my fibromyalgia, which is inflammation through your muscles, my arthritis. Yes, it's all going to get better. We're not treating just fibromyalgia. We don't have a treatment for just arthritis. We have a treatment for total body health, and it's going to reduce inflammation because inflammation underlies everything. So you can simply take an Advil, or you can get your body balanced, and you won't need any Advil because your body will be controlled by itself. This as opposed to the chronic inflammation, it's really more concerning. You can have a C-reactive protein or 2 or 3, and over decades that will be enough of the smoldering inflammation that can cause enough degeneration in an organ to bring on a life-threatening event. But the only way to really correct these things, and why they haven't found a drug that corrects them, they'll keep looking because drugs are the only things that we know that are powerful or profitable enough to use. You've got to get the body balanced. It's a total body approach. It's, again, the 3 main components of what we do, and that's what does it. When you do these things together, that's where the power of the new medicine protocols come in and how it happens so quickly. It's what amazed us over the last 5 years when we started to see our patients who we began treating virtually. We'd see them in 3 months and simply could not believe the improvements that we saw, could not believe the improvements in the biochemistry we saw, and knew that this is what should be formed as the new standard. So inflammation is extremely important, more important than whatever diagnosis you have. You need to figure that out and reduce it. Here's how hormones tie in. We're all, and you can refer to the hormone webinars we did. There's a 3-part series, very, very important hormonal systems in the body. It took us an hour and a half or two to explain it in an overview. We're estrogen dominant. Estrogen is inflammatory. We're insulin dominant, as in diabetes. Insulin is inflammatory. We don't know if leptin's inflammatory, but I bet it is. That's the hormone that controls our hunger and our weight. It gets out of control as we get hungrier and heavier. I'm sure it does affect inflammation. And of course, toxins. When we ingest a toxin, you're going to become inflamed. You get a bee sting, or you walk into a cloud of dust, or a moldy building, you're going to get swollen and inflamed, whether you feel it at the site of an injury or a sting, or your lungs or your sinuses, you start coughing, watery eyes, that's inflammation. That happens throughout our body, and our hearts, brains, bones, immune system become inflamed. Now, to combat this inflammation, we have natural systems that reduce inflammation, like cortisol from the adrenals. Water, we don't drink enough. Omega-3s that are very anti-inflammatory. androgens, testosterone and progesterone, as we explained in the hormone webinars. We are deficient in these. So we've got this double whammy from, we're getting pancaked on both sides from all these increasing inflammatory causes and our body's inability to deal with it. So we're incredibly inflamed. And that's what leads to all of these illnesses. Cortisol is deficient from adrenal issues. The androgen deficiencies, estrogen dominance, we've talked about that. Vitamin D3, my #1 favorite nutrient, although it is a vitamin, and it helps balance the immune system. Vitamin B deficiencies and their relationship to homocysteine, omega-3s we talked about. Water in itself is a natural antihistamine. So if we just drink enough water, as we talked about when we discussed our food pyramid, water is the foundation of all life. 70% on the planet, 70% in us as well. Drink a lot of water every day. Good water. This is a busy slide here, and we'll make this available. Take some time going through, but it just shows how all of that ties together. The toxicity, the nutritional deficiencies, the hormonal imbalance, all contribute to the inflammation, and off of that becomes a lot of oxidative stress, which is aging. That's why we age more quickly and we degenerate. And how new medicine focuses on those three things foundationally to correct. And we see such improvements in most things. Then we see what else is left. Is there more of a problem in our GI tract? Is there more of a problem somewhere else that we need to dig into deeper? But most of the time, people feel so good, and most illnesses are starting to resolve so quickly that everybody's off and running, having a good time, feeling good, living healthily and functionally to at least 80 years old, even though we're designed to 120. That's what we're supposed to do. Look at third world countries that are healthy, that aren't toxic, out in the jungles. These people look incredible at 100 years old, and we know they live well past that very frequently. That doesn't happen very often here. And when it does, we don't look very fit. So there was a webinar on cancer. So I'll just gloss over this. It's #1. It's really the one to be afraid of. We're all getting it. 1 in 2 women, 1 in 3 men. People are now getting it 2 or 3 times. It was extremely rare 100 years ago. Of course, we didn't live as long and didn't have as much exposure, but the toxic exposures of cancer-causing chemicals and our overall health and immune system strength is just declining. So it's the one. It's the one that's going to be the epidemic. It just makes sense. It's the end result of just all the toxicity and all of the imbalance. I think we get degeneration in our organs along the way, and then eventually our body just goes haywire and starts to grow these tumors out of control. And it can be anywhere. It doesn't matter if it's heart or breast or prostate, lung, bone. We're getting it everywhere. Pancreas. It can pop up in any organ system, just as the inflammation can pop up. We'll end this diagnostic series on genetics. Is it our genetics? Of course our genetics decides what happens, but it's not programmed in our genetics. Our genetics are simply responding to an environment and nutrition and toxins gone crazy, and they don't know what to do. They're confused. So we are not winning. The ribbon campaigns are doing nothing. They raise awareness, that's great, but they're unfortunately very corrupt as well. Focusing on prevention, focusing on early detection and treatment, the profitable side, not prevention. How do you prevent cancer? With new medicine. You detoxify the chemicals, you learn, you experience the counseling that teaches you where all of these cancer-causing chemicals are coming from. Everything from our foods to medications to our homes, our makeups, all of our household chemicals. We have to learn this, and it's easy to avoid once you learn. And you detoxify the body, and you get the body healthy, and the body does the rest. So unfortunately, that's not very profitable. It only costs a couple $1,000s. You learn it once, and you live it the rest of your life. So cancer, the profits are in the tens, hundreds, millions of dollars. I think they're in the tens of thousands of dollars just for one drug. So, and that's part of our failing economy. So it's unsustainable. We know this. It's happening right before our eyes. We're in the very middle of this unsustainable downward spiral, of which I think healthcare is one of the biggest components, both the financial aspect, our ability to get along, our ability to be healthy and enjoy life, our ability to be happy and purposeful. Our health is failing, and we're not happy, and we can't get along. Our relationships, our global, our geopolitical environment, we can't get along. Nobody feels good. Increasing toxicity, chemicals, foods, drugs themselves, traditional medical drugs. If they're a drug, they're synthetic, that's a toxin. Look at any of the small handouts that come with them. Most have carcinogenic causes, so effects. Look at the synthetic hormones that have been used in women for so many years. It doesn't make any sense. Now we're moving on to genetically modified things. It's getting very scary. We don't know what that's going to do. We start messing with our gene line. Who the heck knows if we're going to be able to correct that? We can detoxify ourselves, but who knows if we can restore genetic health if we start to artificially change it, and we're already starting to do that. So again, only 2% of genes of people's genetics are actually incorrect. So talk about things like cystic fibrosis, muscular dystrophy, Lou Gehrig's disease. These things are genetic, and hopefully we will find those genes and turn those off or fix them. But everything else out there is not. Our genes are slowly mutating from the toxins, but they can heal themselves if we remove the toxins. So we talked about this. Just going to gloss over these that were the flip side of the toxicity of cancer is that our decreasing immune system's ability to recognize it and handle these cancer cells. Cancer cells pop up all the time, and our immune system should be strong and healthy and able to deal with those cells, but that's becoming less and less efficient. So more cancer cells, less health to control the cells, and what do we get? Lots and lots of cancer. And I will really gloss over this slide. We focused on breast cancer that night for about half an hour, and it was a good talk. But breast cancer is out there at the top, becoming more epidemic all the time. Incidence is increasing. The only year it decreased, and it was very slightly, was when women got scared from the Women's Health Initiative and everybody stopped taking their synthetic hormones that same year. So there was a little bit of a drop, but then it picked right back up. And the fact that we're still using these synthetic hormones is absolutely embarrassing, unbelievable. Getting into the real ones, the next real killers out there: heart disease, cardiovascular disease. We're talking about heart attacks, brain attacks or strokes, peripheral vascular disease, problems in our blood flow circulation anywhere. Retinal problems are cardiovascular. This is very simply inflammation in the arteries. The arteries are sick. They're inflamed. They are pipes. Think of plumbing that's corroding and having things start to stick. We can see this coming with the high homocysteine levels, high C-reactive protein levels, the hormonal imbalances that we talked about, the insulin, estrogen, leptin excesses, the adrenal, cortisol, androgen, thyroid, growth hormone deficiencies. This all contributes to this inflammatory problem, and genetically, some people are going to display it in their cardiovascular system first. Talk a bit about electrical problems in the heart. We're full of electrical toxins, heavy metals, things that conduct electricity. Our heart tissue does get old and degenerate as well, but we've got these heavy metals in there too, so we have a lot of now arrhythmias and need for pacemakers, things like that. Again, we just have to clean the body out and reset the foundation, and that's how we'll get there. So we're off chasing the heart disease gene, and that doesn't make any sense. There's not one gene that's going to be responsible. It is multifactorial. It is this combination of biochemical, hormonal, structural, electrical imbalances, toxicities. We can talk about pinched nerves from our spinal cord going to our hearts. That's where chiropractic, structural, electrical, acupuncture can help. That's not my area of expertise, but we know it helps. But the increasing epidemic of this problem, 85% of us are getting this. Our arteries are inflamed, we're imbalanced, and it is not the fault of any one natural molecule. We're focusing on cholesterol, on blocking platelets, which is about the stupidest thing I've ever heard. Platelets make us stop bleeding. You don't want to stop your platelets. You can have a bleeding problem, and the drugs we use are potent. When we have these corroded pipes, these inflamed arteries that we can see in our blood work years and years in advance, decades in advance, things start to stick. Cholesterol will stick, platelets will stick, white blood cells will stick. It doesn't make any sense to artificially reduce these natural, vital molecules to prevent heart disease. You're not preventing anything. You're just going to reduce the size of the plaque a little bit, of the buildup, but you wouldn't want to turn off the white blood cells. You'd get sick and die of, that's what AIDS is. You'd get sick and die of infection. You can't completely turn off the platelets. You would bleed. We just try to turn them off as much as possible without bleeding to death with things like Coumadin and Plavix. The cholesterol drugs will be the mistake of 20 years very soon. We know how horrible it is to turn off that important system. They form hormones. They are antioxidants. It's incredible how simple-minded these treatments are. We have to get to the underlying causes. We have to get the artery healthy and let it heal. It's like a scab inside your artery, and eventually that scab will get loose and just rip off, and that's what will block the artery. So just making the scab smaller really doesn't do much. If the wound is still there, it's going to continue scabbing. We have to heal the wound, and that can only be done by restoring health. Hormonal imbalances, we talked about, are a key part of this. So the key tenets of new medicine is how you fix heart disease. Does this help heart disease? I've had a stroke. I have a history of strokes. I have a history of family heart disease. Will new medicine help? Of course, because this is what is underlying. This is the true cause of why the artery is sick. It's these imbalances. And our thorough labs are how we find these imbalances and set them straight. Check your homocysteine, check your C-reactive protein, check these hormone levels. Almost no doctors check these. And we'll talk about insulin in a little bit more detail, but that is the most powerful hormone to look at for diabetes. They don't check that. They simply check your sugar. Sugar is the last thing to get out of range in diabetes. Insulin is the first thing, and insulin is incredibly inflammatory. So all of these things work together, and that's why we get the labs we do and restore balance. We detoxify the excess hormones and toxins out. We teach the patient through the process, which is only a few weeks to months. We teach them how to stay that way, how to avoid it, how to do the best they can as they travel and live life and have fun. We restore what's missing. We teach nutrition. They have a renewed sense of healthy food and nutrients. We simplify their lives. If they are taking a lot of vitamins or other things, we simplify. We give them only what they need. It's typically a handful of things, a few key nutrients, a few key vitamins or hormones. It doesn't matter whether it's called a vitamin, a nutrient, or a hormone, or a supplement. It's something we need. It's bioidentical, and we have to restore it. Some things will come back naturally with treatment. If you lower insulin, growth hormone can come back. As you lose weight and eat more regular foods, thyroid can come back. Some things need to be replaced. Androgens need to be replaced. Oftentimes adrenal hormones, key vitamins that we simply don't produce enough of because of our lifestyles, like D3, need to be replaced. We do that, the body starts to heal. Of course, we can work on the neuroelectrical imbalances too, spines that go to these organs, these arteries that all keep the body happy. And as we feel better mentally, this is the most important part. Mind, body, spiritual things. So important. But it's hard to get there unless we feel good. And that's what we do first with new medicine. With these three key principles, we get people feeling well quickly. Then they are able to start getting more balanced mentally. So that's heart disease, and it's a killer, and it's now in our kids. Kids are now getting high cholesterol. They're getting the heaviness and the high sugars that lead to heart disease in their teens or even younger. And the modern medicine's answer is we need to start giving kids cholesterol drugs. That's insanity. Let's start asking, why is this happening? And this is why. Because the problems are getting so much worse so quickly that now it's not taking 5, 6, 8 decades to get these illnesses. It's taking 1 decade, or not even. That's because these problems are getting worse. So one of the other big ones, and this is more of the fun part of getting healthy, is that you lose weight. And this is not the primary. Obesity really isn't a disease as far as we're concerned, as none of these are. It's, again, another sign the body's not healthy. A sign and a cause of poor health. So many people are there now. BMIs should be nice and low, around 20. Can vary with muscle mass. But we should be nice and lean. We should have lower body fat. 10 to 15% in a man, 20 to 25 in a woman. You get under 10 or 20%, it's great. It takes a lot of work, may not be worth the effort, but our bodies want to be lean. Look at back several thousand years ago. That's what we were supposed to look like. Cavemen, the caveman diet, that's kind of what we teach. We're lean. And what we're seeing now is caloric excess, too many calories, no nutrition, toxicity, hormonal imbalance. What do our bodies do? We're looking at it. They get big. We're making the foods we eat, the livestock, everything, we're giving them toxins, hormones, chemicals, antibiotics to make them bigger, fatter, faster. And we're becoming just that, bigger, fatter, faster. So we're being overfed, too many calories, cheap calories. That's really the problem. You can get a 500-calorie $1 double bacon cheeseburger, or you can get a 100-calorie, $1 snack of vegetables. Because of our imbalances, everybody's craving these foods. And that's another thing that we have to get through. We have to reduce, restore all of these imbalances that cause these cravings, that cause this overfeeding. And it can happen. It happens quickly. It's all the things we talk about. Detoxifying, restoring hormonal balance, reducing leptin, makes us less hungry, restoring cortisol, lets us crave sugar less, and salt less, and foods at night less. So it's just obesity, heaviness, weight gain is just a huge sign we're not happy. Our bodies are loaded in hormone excesses of estrogens, leptins, insulin. We're deficient in the thyroids, the growth hormones, androgens, testosterone, progesterone. We're taking way too many medications. That just makes everything worse. Makes the deficiencies worse. They're toxic. The medications cause more nutrient and hormone deficiencies, and of course our lifestyles. We don't live the way we should. We're not very active. We're glued to our computers, our TVs, but we don't feel really good enough to get active. And so that's never something that we stress immediately. The common question is, should we exercise? Yes, but let's get you feeling good enough to exercise first. When you see the weight coming off and you feel better, you're going to want to get moving, and we just recommend you do whatever you want. That's fun, that'll keep you doing it. Everything from meditation to going to the gun range, kickboxing, gym, walking, you name it. We have to teach food, education. We have to detoxify the chemicals causing the excess cravings, the hormones causing the cravings and the weight gain. Talk about a hormone in particular. Estrogen should not be given to hardly any women, and it's the #1 thing given. It's where we do really conservative hormone replacement. Estrogen causes weight gain. It causes uteruses and prostates to get big. It causes inflammation. It causes cancer. It causes all the things we don't want. It's useful during pregnancies, and once you get through menopause, you really shouldn't have any more estrogen, and we're just taking loads and loads and loads of birth control pills and Premarin. It's in all of our livestock that we eat. And we're deficient in these more lean promoting hormones, growth hormone, thyroid, testosterone. They're very deficient. They're shut down, as we described in our hormone webinars, by toxic interruption. We have to reduce and eliminate the medications. We don't need them when we restore health. So it's just one more barrier to getting healthy. And then we feel good and we get active. So this weight gain and obesity can be a downward spiral. You have to break the cycle. The common treatments you'll see out there that fail every time and make things worse are amphetamines or metabolic stimulators. It's only going to artificially stimulate the body to burn off fat, but not just fat, muscle, and bone. When you remove the amphetamine, the metabolism slows way down, and you just gain the fat right back, and you're deficient in bone and muscle, so you're actually fatter. That doesn't work. The HCG program that we use as a detoxification has to be done the right way. We talked about that in another webinar and how it's being really abused out there in almost every clinic that we see, especially in America. It's got to be done correctly. We do have to go on reduced calorie diets, but you have to feel good when you're doing it. You have to mobilize your fat. You have to be doing it all naturally, learning organic nutrition, and learning food education, lifestyle education. It has to happen, or it'll never work. Then get active, feel better. You've got to feel good. You've got to get your hormones balanced correctly, the right way, efficiently. And you have to break that hunger cycle of the excess leptin and the excess insulin. All of this works together. That's the beauty of the protocols we use. We do it all at the same time. And it's amazing to experience. We tell people how fun it is the first time. And it's just life-changing. So the solutions are detoxifying, getting the toxins out, restoring energy, getting the hormones balanced, getting the hunger, the food appreciation, and watching the symptoms go away. blood pressure drops, weight drops, insulin drops, diabetes can disappear, inflammation drops, cholesterol drops. All of these things we're told are wrong with us that we need medications for go away. We remove the medications. So this should all be medically guided always. And part of the things that we're working so hard on is to have everybody working together with a strong medical scientific background, but allowing people to go out as health counselors and teach people how to do this, but always have that medical backing that needs to be there. Teach how to detoxify appropriately. Teach how to use correct bioidentical hormonal balancing appropriately to all these physicians that are doing it inappropriately. Be very cautious with the anti-aging groups and the excessive hormone groups, and there's some big popular people out there, well known, that are really promoting excess hormones, and that's not the way to go. It's got to be appropriate. So moving into diabetes, does this help diabetes? Absolutely. Is maybe the most remarkable way to treat diabetes because it will correct so quickly. Again, we've talked about how many people have it. 50% may have it by 2020 officially. About a third do now, and another third are developing it. But really, everybody's getting it. So all of these things, heart disease, cancer, diabetes, autoimmune disease, is it really family history? Is it really, oh, it's in my genes, it's genetic, my brother, my dad, my sister got it? No, we're all getting it. So it's genetic for humanity. All of humanity that's following this way of life, this way of eating, this way of treating health is getting these illnesses. So we need to stop focusing on genetics and focusing on why we're getting it. And diabetes is really, in a word, sugar, glycemic index, glycemic load, too much starch, too much sugar, too much grains. You know, we followed the FDA food pyramid of the 80s for 20 years. We all had 8 to 12 servings of starch and grains and sugar, and then we went on a low-fat craze for 10 years with more sugar. And what happened is we all got more diabetes and more heavy. So it's easily reversible, but you have to reduce. And the number one lab test is insulin. We'll talk about that in a second. It's insulin resistance. We have so much sugar in our body's cranking out insulin, and it just stops working. Our body becomes resistant to the insulin. More and more insulin doesn't work, and eventually we need insulin. We're so resistant to our own bodies, we have to put in extra insulin, and that's end stage. We can even reverse that to a large degree, but without insulin resistance, you can reverse it almost every time. And of course, diabetes also relates to other illnesses. It's going to promote more inflammation. It's going to promote more weight gain. It's going to promote more estrogen. It's going to promote more leptin. It's going to reduce other hormones and deficiencies. And so all of these things, all of these quote-unquote illnesses are just things that will eventually all come about unless something gets us first. Here is how you evaluate diabetes. And here is, these 4 markers are very important. Typically, this is the main one that's looked at, fasting glucose. Your sugar level, your finger stick. Well, glucose goes up and down all the time. And yes, if it's going up over 200, there's certain levels that are going to be suggested for diabetes, but you're going to see the diabetes developing much sooner if you check fasting insulin. Because that's how much insulin is in our body when we're not eating. And if it's over 5, we're developing insulin resistance. If it's 10, 15, 20, we're really developing it. It should be as low as possible. Also, triglycerides shouldn't really be in the cholesterol profile. They really show you how you've been eating recently. How sugary is it? These should be below 100. Hemoglobin A1C is typically only checked in people once they have diabetes. And that's, how's your blood sugar been over the last 3 months? Well, we check it in everybody because it's going to creep up slowly as well. And once it gets over 5.5%, you need to start thinking about your sugars. Once you are over 6%, you are officially pre-diabetic, and the talk needs to get serious. So again, you can see these things coming from a mile away. Diabetes is really simple. Get on a program that's going to detoxify you, drop the weight, drop the insulin, drop the excess everything, teach food education, and down comes the insulin. And it reverses just that quickly. We see insulin levels drop from 28 to 8, from 16 to 3. Off come the diabetes medications, and off comes the risk for other diseases down the road. So cholesterol is the bad guy, just the joker of humanity, the evil person that we should just eradicate from our body, and the lower we get it, the better, which is one of the biggest misconceptions out there. And It is a natural chemical, and we need cholesterol. However, it's becoming very high in so many of us, 1 billion people, because it is also a stress marker. So when our bodies become stressed, and specifically our liver becomes stressed, there is a reaction that tells our body that we're experiencing that inflammation. We're experiencing that inflammation that's going to lead to oxidation. Our livers are getting backed up, and what happens is our liver says, let's make more antioxidants, and LDL happens to be one of those antioxidants. So LDL is climbing in almost 1 billion people because of that problem. Now, does that mean that we all need to take a medication that's going to turn off our cholesterol? Absolutely not. That's the worst thing we really could do. Again, it's simply going to lower the cholesterol artificially a bit. That can lower the size of that plaque. That's all it's going to do. It's actually going to make worse the functioning of our liver. It's incredibly toxic. Cholesterol is so important for hormone production, energy production, healthy everything. Makes no sense. And we're going to find, and we are already finding, there's already stories of how incredibly toxic these cholesterol drugs are. Unfortunately, very very profitable. But I think the news is kind of out. People don't want to take them. They don't feel good. They typically feel pretty weak and achy. And we typically see the LDL, again, because it's a stress marker resulting from toxicity and all of the imbalances we talk about, we see cholesterol drops tremendously. We're going to, after this diagnostic series, we're going to finish up with a whole bunch of case studies, of which most of them show just tremendous cholesterol drops, LDL drops, because we're reducing these stresses to the liver. We're reducing all of the stressors to the body, so we don't need to produce as much LDL. So we see drops of 50 points or more within 3 to 6 weeks very commonly. Now, every now and then, not always, every now and then there may be something left that's stressing the body. Maybe there's still a toxin. Maybe there's something that we haven't gotten to yet, but it's rare. And even if we don't, cholesterol is not the bad guy. You know, Eskimos, people that eat very heavy fatty diets have cholesterols in the 400s. They have no heart disease. They actually have bleeding problems because they have so many omega-3s that it actually thins their blood too much, but there's just not a direct correlation with high cholesterol. So what we look for is balance. We look to try to get the cholesterol picture balanced. Of course, we like to see the LDL drop, and we, more importantly, want to raise the HDL. And HDL is the good cholesterol that carries a lot of bad stuff out of the body. It's incredibly important in overall vitality and predictive of a long life. And we see it increase. We're going to talk about it in a second here in a slide, but a quick story of triseptropib, which, you know, these drugs that we take are the most toxic sounding things I've ever seen. I think they must try to pick drugs that sound just completely unnatural. This one, looking for a big, you know, blockbuster drug, this one was killing everybody. They had to stop the study early. Well, we see HDL levels increase typically 5 to 15 points, again, within 3 to 6 weeks, because there are 3 key things that cause HDL to be low, and that is a lack of androgens, testosterone and progesterone, a lack of exercise, which is a result of getting healthy and feeling good, and a lack of healthy fats, which is something we teach we need to restore. We need to eat healthy fat. We need to not eat unhealthy fat. So here's a nice diagram of why cholesterol is so high in so many people and how new medicine corrects it. So will new medicine help me with cholesterol? Absolutely. Better and quicker and cheaper than any drug out there, and along the way you're going to lose weight, feel great, and reverse almost every illness you've got. LDLs are antioxidants, liver body stress, toxins, nutrient deficiencies, imbalanced hormones, mental stress, and physical stress can cause high LDL. There's the low HDL. So we're going to reduce all those things that cause the high LDL. We're going to replace all the things that lower the HDL, and we see these incredible improvements in the overall ratio of LDL to HDL. That's the important thing to look at. Testosterone, progesterones can increase it by 10 points. Everybody is deficient in these. Refer back to our hormone webinars. Healthy fats, exercise. We can see just really, really, sometimes we get labs back and the first thing we say is, oh my gosh, call the FDA, call the AMA, tell them what we did. And this is, we do this all the time, but what the heck are they doing giving everybody these drugs? Right along the lines of high cholesterol is high blood pressure. Again, very, very common, over 1 billion people. Is it an epidemic genetic illness, or is it just a symptom that our bodies are stressed? When we're stressed, our bodies are getting that fight or flight response. Up goes the blood pressure. We see it correct over 90% of the time, typically very quickly. We have to be very careful to remove the medications because people can get low blood pressure. And we didn't start doing that until we were trying to be politically correct and not step on toes and work with all these traditional doctors. And we would tell our patients, listen, your pressure's getting too low. Go back to whoever prescribed this blood pressure med for you and ask them to please taper it and remove it. And these doctors would not do it. They're of the mindset that, oh my gosh, you've got to be on your blood pressure medication forever or you're going to die. You're going to die if you take too much blood pressure medication and you don't need it. And so we skillfully but easily remove blood pressure medications typically over the first few days or weeks of treatment. Cholesterol medications, by the way, are thrown out the window typically day one. And mental, psychiatric meds, antidepressants especially, very, very potent. We remove those carefully over a matter of weeks or a few months. So anybody on these meds, we just need some good medical management, and that's what new medicine is all about. Now we're also, of course, not of course, but it may not be obvious, autoimmune problems are all coming from these things as well. Lupus, RA, MS, thyroiditis, allergies, asthma. Here's some other ones you may not have heard of. You can lump in fibromyalgia in there, chronic fatigue syndrome. These all respond. All of these illnesses are really, really poorly understood. They don't understand what's going on. And no matter what disease you have and how many specific little tests they'll run on nuclear antibodies, all they treat people with are drugs that turn off your immune system. So the immune system is confused. It's reacting to something, either a toxin or something that looks unnatural, and it's going haywire. In lupus, it's attacking your kidneys and your connective tissue. In rheumatoid arthritis, your immune system's attacking your joints. In MS, your nervous system. And thyroiditis, your thyroid. Allergies and asthma, food allergies, we're just becoming more reactive to everything. PMR, fibromyalgia is muscles, and I think chronic fatigue is just a mix of everything. They're all inflammatory reactions, and they're very poorly understood, and you don't need methotrexate or prescription prednisone or any of these things. What you need is to detoxify the inflammatory chemicals out, to restore health to the body and the immune system with hormonal and nutritional balancing, and to teach how to avoid these things. Also in here, GI problems, ulcerative colitis and Crohn's. These are horrible illnesses. This is all epidemic, and this is all multifactorial from the things we talked about. They all start to resolve. This one here, Kogan's, just one patient there, but very interesting. That's an autoimmune condition where you start to lose your eyesight and your hearing. And cortisol deficiency is a huge part of this. Cortisol, adrenal fatigue. If you listen to our hormone webinar again, huge part of hormonal deficiency. Bioidentical cortisol is completely opposite of synthetic steroids that are prescribed. It will turn some of these things off immediately, and it is deficient in most all of us, and it's severely deficient when people get these illnesses. And it's natural, and it's well tolerated, and we have a lot of healthy people we teach to take bioidentical cortisol just as needed. When your adrenals are tired, you take it. The media will teach you that cortisol is in excess. That's why we all have belly fat. It's completely incorrect. We're way through cortisol excess by the time we start getting sick and not feeling good. We're in a cortisol deficiency. Another complicated slide here relating, again, toxicity, nutritional deficiency, hormonal imbalances to immune system dysfunction, and what parts are overstimulating the immune system, what parts are making it weak, and how new medicine corrects all of this. So this was just kind of a brainstorming session we had. It is a lot here, but it really is just kind of lays out how all of this interacts and why immune system problems are so prevalent. And to touch quickly on kids, we'll talk about juvenile illness. In kids, they're going to be getting things that don't take as long to develop. So, and in organ systems that are much, much younger in development. So what are the organ systems that take longer to develop in children? We're talking about the neurological system, the immune system. Those things are young, and they take the first 10 or 20 years to develop correctly. And they experience the same toxic and confusing effects. So what are we seeing in kids mostly chronic illnesses, autoimmune illness, and neurological issues, hyperactivity, autism, autistic spectrum, fatigue, problems with puberty, hormonal problems. Those are the systems that are the most sensitive in kids. The other problems, the osteoporosis, the heart disease, the Alzheimer's, it's going to take more time for those systems to break down, and they're a bit more well developed than these other systems. So we're seeing the same chronic illness in kids. It just presents differently because of their state of life. I think we're doing pretty well tonight. I'm going to keep trying to power through this diagnostic stuff and have a really intensive seminar. Thank you all for hanging in. Osteoporosis, we touched on this. It's multifactorial again. Hormones, incredibly important. Estrogen, dominance, weakens bones. Androgen, deficiency. Androgens strengthen bones. Of course, we need minerals, but not just calcium. The milk is toxic. It's full of estrogen. The pharmaceuticals just keep the bones from breaking the bone down, and the bones just keep layering on bone after bone after bone, and we wind up with very hard-looking brittle bones. So it makes the scans look better, but the bones still break, and in some places they die. We need to correct the inflammatory problems, the hormonal imbalance problems, and the broad spectrum nutritional and mineral problems. We take more calcium, more milk, and more pharmaceuticals for bones than any country in the world, and we have the highest rates. So we're not winning. Again, like cancer, like any of these illnesses, we're not fixing the problem. We still have, we're actually seeing more of the deficiency things we haven't seen for a long time, like rickets and scurvy, the vitamin C and D deficiencies. Haven't seen those for a few centuries, but now the foods and the lifestyle is just getting so deficient. And again, this is multifactorial. So osteoporosis is multiple mineral deficiencies, broad spectrum, magnesium, potassium, phosphate, boron, silica, and calcium. The hormones are so crucial here. We need to exercise a bit more. Weight-bearing exercise is going to make them stronger. And we've got to get these misconceptions out of our heads. We've got to get educated. It's all part, again, of what we do. It's not milk. It's not calcium. It's not taking drugs because we're all getting osteoporosis. It just makes no sense. These drugs are actually very, very dangerous, so we want to remove those quickly like we did the cholesterol drugs. Here's our chart for osteoporosis. Number one here, vitamin D3, the super nutrient missing from all modern humans. Everybody should take 5,000 units when you're sick or run down. If you are obese, start with 10,000. Get your levels tested and keep them high normal in the 60 level. If you're fighting cancer or an acute illness, you might want to go as high as 100. That's something we'll monitor medically. The multiple minerals we talked about, the nutrients, the exercise, getting rid of the toxins, and balancing the hormones, androgens, growth hormone, adrenals, and here's the primary culprits, the deficiencies that lead to the inflammation, the weight gain, the hormonal imbalance. So it's multifactorial. And again, but it's the same three things: detoxify, replace hormones, replace nutrients. The three principles of new medical health. Osteoarthritis, chronic degeneration in our joints, a chronic inflammatory condition in our cartilage in so many people. No, it's not natural. No, we don't all need Advil and Tylenol all day. We can have it from overuse, so athletes, jobs, certain things that we do, yes, you can wear down your cartilage. That's part of it. That may not be reversible, but if we keep the inflammation down and we keep the nutrition and the hormonal strength up, we're going to keep our cartilage strong as long as we can. And then, of course, all of these medications, we're going to have aches and pains. The typical arthritis medications, the NSAIDs, or the non-steroidal anti-inflammatory drugs like Motrin, Voltaren, there's so many of them. They're so similar. Ibuprofen, Aleve, Ketorolac. They're all similar, and they can be used from time to time. You can have an ache or a pain. You shouldn't abuse them. They all have side effects: stomach wear down, platelet problems, kidney problems. They tried to avoid these with Celebrex and Vioxx. Vioxx was kind of the kicker that convinced me it was time to leave the traditional world. I was being told to prescribe it to everybody, and it wound up killing a couple 100,000 people. So there you go with that. Not the way to go. Touching on that quickly here, some common drugs. They're also similar. All have effects. They really are abused. And you're going to control most of your inflammation with all of the things that we're going to restore with the biochemical and nutritional balance. Moving on, let's see how much time we have. We're getting down towards an hour. We'll see. Let me take a peek at where we are. And we're getting pretty close. If everybody can hang in there, I'll see. You're of course welcome to jump off. If we're all doing pretty good, I might hang in for another 10 or 15 minutes and finish up this model, and I'll get to this question at the end of that. To talk about pain control, Tylenol, I hate this drug. It's really worthless. It doesn't do much except dull pain a little bit. It is so toxic. It is the most commonly overdosed drug. It is in everything from Tylenol PM to cold medicines to narcotic combinations. It shuts down your liver. 4 grams is toxic. And again, it's the #1 cause of death from medication overdose. It's not that effective, and really it's just not that useful. So I'm not sure why it's in everything. I guess there's some agreements, some behind door agreements, but we really should avoid that drug. Doesn't do a heck of a lot for fever control either. Maybe a little bit more effective there. Steroids, very important here. Now, steroids are going to reduce inflammation, but there's such a difference between the prednisone and the dose packs, the methylprednisolone. Synthetic steroids are, like all other drugs, are so toxic and so degrading to tissue that most people feel good initially, but then don't feel real good, and the side effects are horrible. Thin skin, thin joints, thin bones. So completely different. And they can be used for acute injuries. No problem there. But what's really missing in the inflammatory control mechanism of the body is bioidentical cortisol. It's the adrenal fatigue. And again, bioidentical cortisol is so gentle when compared to synthetic steroids. It is extremely well tolerated. It is hard to overdo. You feel good right away, but it's not an artificial high. And it just works. We use it in about half of our patients. Some people need it that are severely ill, need it all the time, and that's fine. It's very safe. Our adrenals aren't making it, and they're never going to. We've got to restore it. We've got to give the adrenals a break. So bioidentical cortisol comes in there. But traditional medicine abuses the synthetics. They're very dangerous. They have very dangerous side effects. And we're using them more and more, both in inflammatory problems and autoimmune problems. What we need to do is correct the sources of inflammation, replace, again, the deficiencies, the cortisol, the D3 that controls the immune system, the nutrients, the balance, get moving, use the joints, and all of this degeneration will slow down. Again, the drugs can be used from time to time for flare-ups, but not long-term. That's where the side effects are going to really come in. Jumping to the eye really quick. I have an eye problem. I have retinal problems. I'm losing my eyesight. I have glaucoma, pressure in the eye. Is this going to help? Well, remember, the eye is a highly vascular organ. Lots of blood flow going there, a lot going on in the eye. Glaucoma is pressure in the eye, very largely related to high insulin, which we all have. So if we reduce the inflammation, if we reduce the cardiovascular illness, we're going to restore health to the eye. Reduce the blood pressure, the pressure in the eye, the pressure behind the eye. I was actually almost went into ophthalmology. I thought it was very interesting, but all I saw was that we were just seeing a small part of what's going on in the entire body. So why just treat the eye when the whole body's the problem? Systemically is where the eye is getting ill. And that's what happens. Cataracts take quite a while to develop, and that's a problem just from chronic exposure to UV light and other things. And if you need a cataract removed, you need it removed. But most of the problems we see even in ophthalmology, in this little organ, the eye, retinal problems, blood flow problems, pressure problems, glaucoma, they're going to get better. They're going to improve as we get the whole body more balanced. UVA, UVB there. UVB is the one that makes vitamin D, and UVA is the one that burns us a little bit more. So that's good to know. There's a reason why everybody wants to go to tanning beds. We're all missing about UVB and D3, and it feels good to get it back. It's not an addiction, like they're saying. Unbelievable. Maybe we'll start prescribing psychiatric meds for that pretty soon. Probably already are. Rheumatology and immunology, this is the autoimmune illnesses we're talking about. These specialists really don't know what's going on. They all do similar tests, yet diagnose different subsets of similar illnesses, and then they all reach into this grab bag of immune system blockers, the methotrexate, the steroids. The new ones are the inflammatory blocking shots, very dangerous, really weaken your immune system to the point where you get infections. For the psoriasis, and these are all immune problems. They all start internally with immune system imbalance, with toxicity. Our skin is a huge flag showing what's going on in our body, what we need to get inside the body and restore it. So all of these immune problems are confused immune systems, toxic inflammation amounts, hormonal and nutritional deficiencies, and we're seeing more and more of this stuff in young kids because, again, our immune systems are very, very immature in our preteen years. So we're seeing a lot of this. ANA, something we'll touch on a bit more. That's a real scientific topic, but it's a marker of our bodies attacking our own DNA, and it's happening probably because our DNA is mutating and our bodies are confused and or attacking something that doesn't look like ourselves. We see this in more and more people. We screen it, and we see it reverse a lot as we detoxify and we allow the body to possibly heal its own DNA. There's mechanisms to do so. Neurology is kind of like ophthalmology. It's another important system of the brain, experiencing the same things: inflammatory problems, Alzheimer's, lack of hormones and nutrients, fats, androgens, growth hormone, very important to maintaining the health of our neurologic tissue. The dementia, the depression, the fatigue, all of these things that happen in older age are really just major deficiencies in hormones. As we get to that age and we see more of these problems, inflammation has been building up for years, deficiencies have been building up for years. They've gone all the way up through our growth hormone system that we described in our webinar, and they've got to be replaced. And boy, do elderly people need this just as much. We may not start off with a detox or do one at all. What we need to do is restore their health, find out what's really going on, and get them strong again. Hormone deficiencies are just a huge part of how we feel with a lot of these neurological conditions. When we're talking about strokes, of course, we're really talking about cerebrovascular problems that we discussed earlier. And jumping into the gut real quick, everything starts in the gut. Healing the gut is a side effect, really, of the treatment because we're going to teach good foods. We're going to restore, we're going to reduce inflammation. We're going to talk about probiotics versus dysbiotics, parasites and things like that. Leaky gut is going to be restored. So we don't focus heavily on the GI system because it's really a side effect of getting everything healthy. Good food, restoring these things. We see all of this happen as a side effect. We don't do a lot of GI testing unless we have to, unless something in the immune system isn't quite right still after we do the basic treatment. And let's talk real quick about the big guts. It's not just fat. We are backed up with toxic stool, with toxic poop. It's disgusting, but we've got to talk about it. That is half of what's in everybody with these big bellies, and it's got to come out. Beer guts is alcohol turning to estrogen that backs up the GI system. That's what it is. It's backed up feces. It's disgusting, and we've got to get it out. That's why it's there. And until you get that out, you're never going to be happy. You're never going to detoxify completely. Even in women, they have the little lower abdominal pooch. That's where it starts. They'll say, I just have my little pooch of fat here. It's actually not. It's actually backed up stool, starting to get backed up very, very low on the abdomen. And you've got to get it out, and it's very obvious to see on an X-ray, which we can do in any clinic. And we talked a bit about the skin with psoriasis. The skin is a signal as to what's going on in the body. It comes from the same origin as the GI tract. So if something's wrong with your skin, something's wrong on the inside. If you have little scabby things in places, something's wrong on the inside. Got to fix everything internally, detoxify, balance the immune system. That's what's going on with most skin problems. Some of the GI balancing we talked about with pre and probiotics. Prebiotics are actually the things probiotics live on: fiber, inulin, things in fruits and vegetables. Talk about getting enough healthy fats. Our skin is water and fat. We need lots of healthy fats and omega-3s. Water here, dehydration. And real quickly on food allergies, we don't test a lot of food allergy because our allergies are going through the roof because of the original problems. The toxic foods that we're naturally not reacting well to, like the wheats and the soys that are all genetically modified, and the dairy that's not a real nutritional food for humans anyways. And then again, our inability to fight this inflammatory reaction. So food allergy testing can be very nonspecific. We've been there and done that with it. It's expensive, it's tedious. You can remove the foods that look to be allergenic and it doesn't really do anything. We noticed that when you do the New Medicine Foundation protocols, most of the food allergies go away. We also teach which foods to stay away from. And a lot of foods that weren't enjoyed or even desired before now are. So that's pretty exciting. Pulmonary conditions, is this going to help lung problems? Of course, it's all inflammatory. Asthma, bronchitis, of course, emphysema, COPD, a lot related to smoking there. But again, if we reduce the inflammation, we strengthen the body, these inflammatory problems are going to go away and things are going to get better. Of course, lung cancer is a huge problem out there. And surprisingly, it's the fastest growing lung cancer is the small cell cancer. That's the cancer that really isn't related to smoking. So we tell people, yes, stop smoking, but there's a ton of other toxins that we need to get rid of too. And the fastest growing lung cancer is the one that really isn't related to smoking. That's amazing. Here we go with a brief touch on juvenile illness, and we're to the end. I'll handle a quick question or two, and I thank everybody for hanging in there. Here's a pretty healthy young girl right here, really what kids should look like, lean and lithe and, not like this, unfortunately. Sad to see kids' bodies doing this these days and how young these problems are starting. And again, chronic illness in kids looks different than an adult, completely different because of the systems that are developing. We're talking about the neurological systems, the immune systems. These systems are the ones that are young and immature and not fully developed, and so these toxicity problems that are there at birth, these hormonal imbalances that are starting at birth, we've tested children as young as 3, these problems are there in mama's womb, in utero. Mom's toxic, the birthing process is toxic, they're heavily medicated, the kids are heavily vaccinated, the foods are completely synthetic, the formulas are horrible. This is starting at birth. So what are we seeing? Autism, ADHD, autistic spectra, depression problems, kids not getting along, half the kids not finishing school, autoimmune system problems, hormonal problems. And what are we treating them with? No education, nothing natural, just drugs, drugs, and more drugs, and worse food. Kids are getting bigger, fatter, faster. They're getting heart disease. They're getting high cholesterol. They're now getting adult chronic illnesses. So again, we're at the tipping point. The time is now to fix these things. What's next? Genetic roulette. Again, right now the problem is toxicity. We can detoxify. We can restore the balance. We can restore the deficiencies. Where are we going? Where's the money going to go? It's going to go to genetic therapy. That is scary. Only 2% of us need it. And we're going to go there because it's going to be so profitable. And we're going to start messing with our genome. We used to think that 40% or 40,000 genes in our body were called junk DNA, and they were just remnants. And that we could go and just start messing with all these gene segments. What incredible stupidity that is. They all do something. We're not that smart, and we're playing God and producing GMO foods. God move over, and we're looking towards gene therapy to go fix the cancer gene and go fix the heart disease gene and go fix the Alzheimer gene. Again, there is no such thing, and we're going to cause a whole new era of unintended consequences. So that really scares me. I'm hoping the system implodes before then. I think it's going to, and we hopefully won't get there. We're seeing younger ages of onset, longer duration of people on medications, and we're really just dying slowly. So we're getting sick in our teens, and we're just, we're on life support medications our entire life. Doesn't make any sense. We touched on a lot of this initially. Our genes have been the same 50,000 years. A lot of this change has come about in the last really 50 to 100. And again, we're all displaying these illnesses. This is a human problem, not a family problem. Our genes are being fed, and our whole body is experiencing something that is not accustomed to. Life has changed. Our foods have changed. What we do has changed. So we need to be careful in going and doing gene therapy. It's really a scary proposition. What we need to do is remove the bad. It could be this simple. Remove the bad, replace what's missing. Let the body do the rest. Detoxify and teach how to avoid this stuff. Remove medications. Find the deficiencies. Find what's really going on. Restore a healthy environment, a healthy foundation. Let our bodies heal. That's what we do. And in doing so, we get healthy, and it happens quickly, and it's amazing. And it's every illness out there. As we touched on tonight, almost every illness will benefit from this. And here's the gene therapy we need to be very careful about. We start changing it, we may not be able to correct it. It may be passed down, and that may be something that's undoable. And I often talk about Wall-E or I Am Legend, where we go and create viruses, or we turn into big diabetic blobs floating around in the hovercraft eating cupcakes in a cup. Hopefully it's not where we're going. Big overview picture here. Let me answer a question from Jerry, always with the really phenomenal questions, may make me think even harder. 60-ish-year-old man, doing very well financially, 60 pounds overweight, big belly, thin hair, gum disease, low testosterone, thinks he eats right but eats out all the time. Typical. Well, this guy's pretty sick. He's going to have severe problems. He's really one event away from death or a severe health problem. Because when you've had 6 decades for this stuff to build up, you're 60 pounds overweight, so you've got really high estrogen, leptin, and insulin levels. You've got thinning hair, and we know he's got low testosterone. He feels it. Probably doesn't feel real good. He's going to have very low levels of D3, testosterone, probably adrenal function, maybe even thyroid and growth hormone levels. He's going to have vitamin and nutrient deficiencies because he eats out all the time. So this is everything bad waiting to happen. It's just a matter of time before he's already got these illnesses, these conditions, these symptoms developing. He's going to have inflammation somewhere in his body. He's going to have more cancer cells popping up. It's a question of what's going to get him first. It's going to be diabetes, a heart attack, a stroke. Where's the illness? Where is the common inflammatory problem going to pop up first? It could be anywhere. He's probably going to have some sexual dysfunction. That's not a need for Viagra. He's got neurological and cardiovascular problems. So that's the common American right there. That's the common executive, I guess we might say. And to back that up, we've got a 45-ish woman who is exhausted, drinks wine after work to feel better, 30 pounds overweight, stressful job, doesn't feel good. She is 45. She's heading into menopause. And women are all progesterone deficient to begin with. As you head towards menopause, the progesterone deficiency gets worse. The ovaries start shutting down. That's natural. But the progesterone deficiency that's already there gets worse. That starts to wear out the adrenals, and all the hormonal deficiency starts to pull down through that pyramid we discuss, and that does not feel good. So that's in everybody, but in women it happens through menopause even more because the hormones change significantly. You just don't feel good, so you've got to go in there and restore the hormones the right way. Even though heading to menopause, the estrogen is still too high from the environment, so you detoxify it out, get the extra weight off. Very important to restore the hormones that are missing, and everything else will fix itself, and menopause should be smooth and easy. So those are great common examples of the common American there, and this is what we hope to do with new medicine and how we blend together with chiropractic and acupuncture and try to get up here to this really high level of spiritual life balance and thinking, and everybody living a healthier, happier place, and get back to this incredible world we're living in, surrounded by new species every day. The earth is just as sick as we are, and green is the new thing. So this is the new thing, and new medicine is here to get back to a better purpose, a more natural way of life, a more healthy way of living, a more sustainable way of living. That will fix our economic trouble. It will fix our geopolitical trouble. It will help with our climate trouble. We can be much more prosperous. We'll save a lot of money. We can actually make a good living helping other people save money. The healthcare system is a $3 trillion system in this country alone. We think if you get healthy naturally, you're probably going to save $2 trillion. So maybe there's $1 trillion there to pay people to help others get healthy, to pay doctors to do things the right way. Side effects of this are focusing on family, focusing on health and happiness, getting moving, sustainability, getting around the dinner table, eating real food, enjoying real food. Those are all side effects. The education, the enjoyment of life is a side effect of getting healthy naturally. All of these illnesses go away. All of these illnesses, remember, they really don't exist. They're just signs that we're not healthy. There's a reason why we're all getting them. We've got to focus on the causes of those problems. Well, thanks everybody for sticking in. We did pretty good, only went about 20 minutes over and got through the entire real compact show about how really this affects all of these illnesses we're told we have. We touched on, by the way, we touched on psychiatric problems in the hormone seminar because psychiatric issues are so big. So many people don't feel well, and that is really the heart of hormones, getting those hormones balanced, and really 90% or more people are going to feel great. If there are any questions, I'm happy to take them, but I'm sure everybody's probably had enough. So I thank you very much for listening. I'll pass it back to our moderators, and if anybody does want to add something. Otherwise, we're going to move on. Next week or two, we're going to look at all of the, just a sampling of the many case studies we have, showing how this affects the young and the old, and the wonderful physical, biochemical, and mental and life changes that we've seen, and just how easy it is to get healthy. So thanks again for listening. I'll pass it back to our moderators.